Hi, this is Navya. So, under this pharmacology subject syllabus, so I have completed all the 5 chapters. If you've not watched these 5 chapters, I have just dropped a link in the description box so that you can watch the later section. So, in this video, I'll be taking a class on the chapter 6, that is Sedative Hypnotics. So, let's start the class. So, under this chapter 6, that is Sedative Hypnotics. So, here we'll be learning about the definitions of the sedative hypnotics as well as the uses of the sedative hypnotics and the effects of these two category of the medicine, the drug, that is diazepam and lorazepam. So, before that, let us know the sedative hypnotics. What is the meaning of the sedative hypnotics? The sedative hypnotics, these are the two classes of the drug. These are the two classes of the drug. So that are commonly called as tranquilizer. This is commonly called as tranquilizer. Otherwise, we in a simple way, that is, we can also call it as a sleeping drug. Sleeping drug or sleeping pills or sedatives. So this makes the body unconscious, this makes the mind unconscious, and also it affects to the central nervous system, that is the brain and the spinal cord. So it mainly affect to the central nervous system, that is for the brain and the spinal cord. So let us know more detail about this chapter. So let's start the first question, that is about the definition of the sedative hypnotics. So here, as I already told, this belongs to the particular class of the drug. So that may cause the dose-dependent depression. Dose-dependent depression means it leads the body in the depression that they may depend, that they have to depend on the dose, that is the drug. The particular amount of the dosage, it has to be consumed from the body. So this cause the dose dependent depression of the CNS function. CNS stands for the central nervous system. Central nervous system. Okay, so that will produce, so that may inducing in the sedation, the sleepiness, unconsciousness with increasing of the dosage. By increasing the dosage, these all the things, effects have been involved from this type of drug, from this type of the drug. And so this drug, that includes in a group that is known as a benzodiazepine and the Z drug and barbiturates and melatonin agonist. And also in this sedative hypnotics drug, so this may affect to the allergic transmission, and that will increase the exceptional of the agonist, which act on the hypothalamic melatonin receptors. So this sedative hypnotic drugs, these are used as anxiolytics and the sedatives and the muscle relaxants and anesthetics purpose. So these all have been used whenever there is a necessary in the operation theater. They have been used commonly for the muscle relaxants purpose. Yeah. And as already said, the common side effects. So that will from the CNS depression. CNS is a central nervous system. So that may affect to the brain and the spinal cord. Yeah. And if the patient use for the long term the sedative hypnotics, then maybe in the high risk of the dependency of that drug. Otherwise he may not withstand or to survive. So this, under this pharmacology, so they have permitted of more specific targeting of the receptors, and also for the greater selectivity of the agents that are necessary for the greater precision when describing these agents and their effect. So one of the effects is that the anxiolytic, this refers to the effect about the anxiety. So, however, some benzodiazepine, this can all the three things, that may be sedatives or hypnotics and anxiolytics. And also we call tranquilizer as this as referred to as the anxiolytics and anti psychotic. So here, so now let us know what are the uses of this sedatives. So this sedative hypnotic drug, as I already said, these are the two class of the drug that may be used for to induce the sleepness for to for the unconscious. Uh, so these purpose and the uses. Let us know the uses. As I said, used to reduce the tension and anxiety by introducing or by just induce a calm or to induce a sleep. And most of the drug exert a quieting or calming effect at low dosage. Just a calm, cool effect with a sleep introducing effect, but that will be for the larger dose. It means that the patient has to take the larger dose to get sleep, and for the less doses of the tablet or the drug, the medicine, for to get the calm effect. And now let us know what are the adverse effect of the sedatives. So some sedatives that may also cause psychological and physical dependence. As I said, it may get addicted. So when taken regularly, so it gets addicted easily. And the next point is that the dependent user. So the dependent user of the drug, the patient or any dependent user, so they may get withdrawal of the symptoms ranging from the restlessness and insomnia to convulsions, and also there is a chances of the death. And for the long term use of this benzophenone, then they may affect that for the brain. So as alcohol, for example, and maybe going to the depression, anxiety, and post-traumatic stress disorders, and the sleep disorders, so delirium, neurocognitive disorders. These are the symptoms, these are the effects from the sedative hypnotics drugs. So here there is a two category. So let us know one by one. Yeah, so there is diazepam and lorazepam. These are the two drugs that is used that comes under the sedative hypnotics group of drugs. So these two drugs, that is the diazepam and lorazepam, these are the two medication that is used to treat the anxiety among the other condition. So we all know this, the sedative hypnosis that also comes under benzodiazepine. In the same way, this lorazepam and diazepam, this also classified as the benzodiazepine. So that will work by increasing the effect of the GABA in the brain. So this is an neurotransmitter that will produce a feeling of the calmness. So the calmness, it just produces a calmness in someone with the anxiety. So although these two drugs, both drugs have same similarities, but the few difference have there. So let us know what are those differences. Before that, let us know the drug lorazepam. Yeah. So let us know few points for this lorazepam. So this is a drug. As in the name we can see, this stands for AT1. So we call this as a AT1 lorazepam. This is the amount of the drug, and as the name indicates, AT1. So this belongs to the lorazepam group. So this lorazepam, this is the generic name, that is AT1. So AT1 or the lorazepam. Yes. So this is the FDA approved one. As I already described in the previous chapter, that is FDA stands for Food Drug Administration. It is an organization. It has to be approved from this from this center. Yeah, so that is used to treat for the anxiety, the panic disorders, and certain seizures. So it can also be given as a pre-medication for someone who is undergoing into the surgery. So as a pre-medication, it has been used before the surgery, before the patient has been going under the surgery. And amount, so let us know what is the amount that is being taken. That is 0.5 mg, 1 mg and 2 mg. The oral tablets, it can also be administered as an injection also, or the oral solution. So these are the amount of the drug. And this is an intermediate acting benzodiazepine. So in other words, what you can tell, it produces the effects that is relatively very quickly, and this is eliminated from the body very faster than the other benzodiazepine. So the half life of the lorazepam, that is about the 18 hours. So it will quickly quickly eliminate from the body easily. Means it stays only for the 18 hours, or like half life, that is 18 hours. So next, the drug is the diazepam drug. So as the name, whereas for the lorazepam drug, it includes 81. You remember, right? 81. But here in diazepam, you can see the name of this. So that indicates, so Valium. So this is a general name for this Valium. So the general name of this is the Valium. And same way, this is also used to treat the anxiety and seizures and the alcohol withdrawal syndrome and the muscle spasm. So like this lorazepam, this diazepam can also be used to treat, so used during or in the, this is also be used in the pre-medication during the surgery. During the surgery, this is also be used in the as a pre-medication before going to the surgery. And coming to the amount, there we saw it was 0.5 and 2 mg, but a little higher amount of the drug the patient used to consume, that is the 2 mg, 5 mg and 10 mg of the oral tablet. This may also get in the form of the injection or the oral solution. And the hours. So whereas the lorazepam, it was the half-life, it was 18 hours. But here in the diazepam, it is for the 2.5 hours to reach the peak level in the blood. So it needs, it takes minimum 2.5 hours. So this is considered for the long acting, not the short one. It's a long acting benzodiazepine with a half-life up to the 100 hours. So this 18 is for the lorazepam, whereas this 100 hours half time is for the diazepam. This 2 hours is nothing but it just takes as the 2 hours to reach to the blood. Yeah, then let us compare this lorazepam and diazepam side by side. So this lorazepam and diazepam, these are the generic medication. So that has some similarity and also some difference. So it is no, the lorazepam and diazepam both. So these are the prescribed for the anxiety disorders and alcohol withdrawal symptoms, panic disorders, muscles spasms and seizures, and also the pre-medication for the surgery. So all are both. Now the drug classification. So here the drug classification is it is a benzodiazepine. This is also benzodiazepine. Both are same. So here this alcohol may come under this diazepam, and all other it comes under lorazepam, and both are generic. The common side effects, this side effects for the lorazepam and this side effects for the diazepam. So here it goes to depression, drowsiness, slow heart rate, heartbeat, trouble breathing, so breathing difficulties, unsteadiness. Whereas here here it is a drowsiness, fatigue, muscle weakness, involuntary movement, hypotension, nausea. So these are the common symptoms, common effects of this sedative hypnotics.